everybody, I'm Jenny June. I'm a certified child and family sleep consultant and lactation counselor and a collaborative provider for the Breathe Institute in sleep hygiene. And we're live here at the Breathe Institute in Los Angeles near UCLA. And today I have with me Dr. Chelsea Pinto, a rock star when it comes to infant tongue tie. She's an infant tongue tie specialist and a general dentist, a collaborative provider here as well. And I brought her here with me because we have so many issues with newborn sleep. And there's not really a lot that we can do with their circadian rhythms because it's not fully developed yet. But a lot of the times it's those eating and feeding issues that can really cause some upset stomach and gassiness and just fussy babies that just struggle with eating and sleeping. They're kind of connected. And so I want to just equip you guys who are just struggling with these newborns right out of the gate and make sure that feeding is going well, because if it's not, then it's going to impact sleep quite a bit, and just you'll have a fussy, irritable baby, and that's no fun for anyone. We're going to get into the specifics of tongue tie, because that's really a big and common issue with babies who are born, and they're the issue with breastfeeding for sure. As a lactation counselor, I see it all the time, and we need to have that looked at. So I brought Chelsea with Dr. Pinto with me. Chelsea, my buddy.
Yes.
But Dr. Pinto to the rest of you. No,
Either
I'm joking. So she's going to answer all your questions, and we're just going to start with the basics, guys, because a lot of you guys don't know about this. And if you're pregnant or in your second or third trimester, getting close to the due date, you're really going to want this information in advance, because if it's presenting, you want to get it handled right away, because it can negatively impact breastfeeding behaviors and milk supply and all of that, and go downhill very quickly. So let's get you equipped with this education. First question is, what is tongue tie? I'll serve it to you.
First off, thanks so much for having me.
Yes,
it's my first Facebook Live, so it's really exciting. Yes, tongue tie. A tongue tie is a really important issue. A frenulum essentially is a cord underneath our tongue, so it's a really small cord, but has a huge impact on our development. If you're wondering what the heck a frenulum is, you can find your own right now if you want. You can open your mouth, lift your tongue up to your palate, and you'll see the little cord that connects your tongue to the floor of your mouth.
Right.
So essentially it's a normal connection in our body that we're all born with. So when is it a problem? In about 5 to 10% of babies that are born, that cord is just too tight, too thick, too short. And so it causes issues with tongue mobility, movement, function, and that can, of course, influence feeding.
Right. And what are some of the possible red flags or symptoms that you might see of a tongue tie situation?
Sure. So many of the moms I see are referred over through lactation consultants in our community, and that kind of report gives me a good baseline of kind of what they've noticed in their sessions together. The big symptoms that I'll see kind of over and over again are kind of that shallow latch, more of creation of a suction through the lips versus utilizing the tongue.
Right.
These babies are kind of just gumming, chewing on the nipple, because if that tongue can't lift up and reach the palate, or lift up and over the lower jaw, that's why these babies are just essentially gumming and causing lots of pain most of the time.
Yes.
I'll also see things like just excess gas, fussiness, having to burp the baby multiple times during a single feed.
Excellent.
And that's because they're swallowing so much air, sometimes swallowing more air than the milk. So, these issues are important whether you're breastfeeding or bottle feeding, either or, but those are kind of some of the main things that I'll see.
Yeah, those are great things to look for. Thank you for that, concentrated, easy to recognize list of things to be aware of when you're breastfeeding your newborn. And we also tend to see just more piston movement with the breastfeeding. You'll see more up and down when they're sucking rather than forward motion. That going back and forth. That's what we want to see. But if that tongue tie is an issue, it's going to be difficult for them to do that and bring that milk through. And you get those sore nipples that are cracking, bleeding, and you want they're falling off on you. We don't want that.
We don't want it, right? And it's it's normal for breastfeeding to be uncomfortable in the beginning stages, and by no means if your baby has these symptoms are they tongue tied. So that's why we really want to focus on diagnosis and going to someone that is skilled and trained with what to look for, because in diagnosing tongue ties, it's not all about just the symptoms. It's symptoms of mom and baby, but also function of the tongue. And then also, of course, what it looks like. And a tongue tie is not always visible to the naked eye.
That's interesting. I think you guys should really pause right there and remember that is a serious issue. It's not always visible to the naked eye. So what is it again that, how do you diagnose? So what are you looking for when you bring them in?
Yeah, so again, kind of keeping on the topic that you can't always see it, it really depends on where that attachment is on our body. So is it more towards the tip of the tongue? If so, then likely anyone could take a look and say, that doesn't look normal.
Right.
Or what I'm used to seeing.
Yeah.
But otherwise, if it's more of a, what they term posterior tongue tie, which can be a little bit confusing, but really what that's saying is that attachment is tight further back in, still under the tongue, still where we're talking about. It's not way back in your throat or anything like that, but you really have to push the tissue back to expose the cord.
Interesting. Okay, so that's something that would be helpful to bring into you to be able to look for any potential issues presenting, because that's not something that most of us would probably feel comfortable doing right away, especially with our first baby. It's hard enough getting all these other things managed, the meconium and all that fun stuff, and
lots going on, lots of emotions flying around, and it's important to kind of have that team so we can work from all these
and
angles.
Dr. Pinto is a mom herself.
I am.
Yeah, so
my son just turned 1. Well, I guess he's already 13 months. So
time goes by so fast.
Time flies.
He's walking around.
He's walking. Saying more words every day, or what we can figure out what he's saying.
Communicating. He's making that. Yeah. So she's a mom, and she understands. All the concerns, the hormones, that the confusion that can sometimes happen in when you're a new parent, and so she she's. It's one thing to to do all of this, but it's another thing to do it with experience of your own in the background, which I love. So I love bringing you Dr. Pinto today. Another question I think some of my viewers have would be, how does a tongue tie affect or impact development? Can you tell us a little bit about that?
Great question. The easiest way to kind of get into this is going back to the whole idea behind tongue tie and the problems that it creates. So if that tongue can't lift to our palate, our natural resting posture should be tongue to our palate, lips closed, and breathe through your nose.
Right.
So if that's not happening and our tongue can't reach our palate, we don't get the natural widening. We should have a widening of our palate just because that muscle in our tongue is pushing against it.
Right.
So if we don't have that, we get a very narrow palate.
Right.
It's high, and so it influences our nasal cavity.
Right.
That gets blocked. So then we have to breathe somehow. And so most of the time we'll see kind of more of this mouth breathing. So instead of getting all that good oxygen through your nose, you now have to create a passageway for the air, and so you'll have kind of a forward head posture, open mouth. With sleeping too, you'll see the kids with open mouth. Even with newborns. I just had a family who, the newborn snores, sleeps with the mouth open, so just not utilizing that nasal cavity.
Right. And if not treated early, it really does developmentally create nasal airway breathing issues that can definitely impact sleep and create a sleep disordered breathing, and just all goes downhill from there, because if your child isn't sleeping well, especially once their circadian rhythms are fully developed, at least for night sleep by 16 weeks properly dated, then sleep debt is accumulated very quickly, and that can impact infant mental health and growth and development in other ways. Not to mention, you're going to be a very tired mama and not enjoying parenthood very much. So, it can spiral out of control real quick, y'all. But
and then some other things that we might see. Just kind of chronic head and neck tension. So even with the babies, they're overutilizing muscles in their neck, cheeks, again, the lips. Right. So all of those areas become really tense and tight, even in young children. So that can propagate through adulthood. And then speech issues too. If the tongue can't reach the palate, can't make certain sounds. If our lips aren't closing, we can't make other sounds.
Right. Good point. And I do see a lot of children with, speech impediments and a lot of the times, tongue tie issues aren't being caught until they're 3-4 years old and these things are presenting. So it's always good to just kind of be aware of these things up front and, and get them checked out, have an evaluation done early on to prevent this, because it's really easy to remedy and fix and correct with a lot less pain or stress on the child, especially if it's done in those that fragile first few weeks or months. So keep that in mind. The other thing too, I had a question about, you mentioned tension in the neck.
Yes.
With torticollis and all of that, is that somehow connected? Because I see a lot of kiddos with torticollis and flathead syndrome, but it's because they had so much tension in their neck. They're favoring laying on one side or using their neck in a certain position.
Right, exactly.
I wonder if that's connected. What are your thoughts on that?
It does play a role, and that's why I kind of collaborate working with body workers in our area that can address that, and it can be a huge issue. One kind of idea that a colleague was talking about is the fact that kids that can't breathe properly, again, kind of turning their head to the side so their tongue will move to make way for the air.
Interesting.
Isn't it?
Yeah. Oh my goodness.
I'm kind of watching a child, a baby, when they come to the office, even from the car seat before I get them out to do kind of our knee-to-knee exam. I'm kind of looking to see which way are they favoring, and there's been a time I do a release to a tongue, and you can even see the tilt on the tongue. The same pattern as the way they tilt their head.
Is that right? Oh my gosh, that's fascinating stuff. I mean, I know this isn't being really discussed a lot. This is why I wanted to bring this to you guys, because we're missing a lot of cues and signs, and it's more common than we realize. Dr. Pinto, thank you so much for elaborating and allowing us to learn from you and what you do, and that and by the way, she is the best when it comes to these tongue tie issues and treating this and examining it. Please just call Dr. Pinto and get a consultation. She's here at the Breathe Institute in Los Angeles. We're going to put a link to the information in the comments below. And throughout the week, if some of you aren't here with us live to ask your questions or bring your concerns or tell your stories, please put your questions in the comments below. We'll both answer those to the best of our ability throughout the week. So don't be shy. Throw it up there. We'll definitely respond to your concerns and questions and get those answered for you. Dr. Pinto, thank you so much for joining us. You're amazing.
Thank you.
All right, guys, we'll see you next Thursday at 1 o'clock. Jenni June, www.jennijune.com if you have sleep issues, and thebreatheinstitute.com if you are really needing an examination for your baby's tongue tie issues or any other sleep disordered breathing issues. This is the place to go. All right, thanks, guys. We'll see you next week. Bye-bye.